get it under control. And yes, of course.
At the beginning of August, Calderdale had just 4 people in hospital with COVID, 0 in ICU and spikes in just 2 wards. This morning we've got 43 people in hospital with COVID, 6 in ICU, 12 deaths this month and almost 800 positive cases coming through. Can my honourable friend say what steps he is taking to ensure that the NHS is not overwhelmed by the virus in the coming weeks?
I have just said that we mustn't have long interventions. These are the speeches that people are waiting to make later. If a member has an intervention to make on the Secretary of State on something he has just said, that is all very well. But making the points that members wish to make about their constituencies at this stage, rather than waiting later, is simply dishonourable. It's just not right. Secretary of State.
Well, Madam Deputy Speaker, my honourable friend, because he is an honourable man, it makes an important point that has wider context than just his constituency, which is that we must make sure that we control the virus. My heart goes out to the families of those in his constituency who have died, because the only alternative to suppressing the virus is that it then expands exponentially. That is what happens with a virus if the R is above 1. And I know that some people do feel that we should adopt a more relaxed approach, but I think it will lead to more of the sort of thing that my honourable friend has related from his constituency. Some people have set out, just 1 second, some people have set out this more relaxed approach, including in the so-called Great Barrington Declaration. And I want to take this argument head on, because on the substance, the Great Barrington Declaration is underpinned by 2 central claims, and both are emphatically false. First, it says that if enough people get COVID, we will reach herd immunity. This is not true. Many infectious diseases never reach herd immunity, like measles and malaria and AIDS and flu. And with increasing evidence of reinfection, we should have no confidence that we would ever reach herd immunity to COVID, even if everyone caught it. Herd immunity is a flawed goal without a vaccine, even if we could get to it, which we can't. The second central claim is that we can segregate the old and the vulnerable on our way to herd immunity. This is simply not possible. As the medical director of the NHS said yesterday, we cannot somehow fence off the elderly and the vulnerable from risk while everyone else returns to normal. It's neither conscionable nor practicable. Not when so many people live in intergenerational homes, when older people need carers who, of course, themselves live in the community, and not when young people can suffer the debilitating impact of long COVID. Whenever we've seen cases among young people rise sharply, we then see cases among the over 60s rise inevitably thereafter. And we are not the kind of country that abandons our vulnerable or just locks them up. If we let this virus continue unchecked, the loss of life would be simply too great to contemplate. And we know it would put our NHS at risk, as my honourable friends have just said. We know this both because of what happened in March and because of what is happening right now. We've already heard from the heads of the Academy of Royal Colleges and the Royal College of Emergency Medicine that if we don't act fast and come together to quash this virus, then we risk putting the NHS under extraordinary strain, both for COVID treatments and non-COVID treatments too. And of course, I'll give way to my